Polycystic Ovary Syndrome, or PCOS, is a common hormonal disorder that affects women of reproductive age. It is characterized by an imbalance of hormones, leading to a range of symptoms that can impact a woman's physical and emotional well-being. PCOS is often associated with small cysts on the ovaries, but it is important to note that not all women with PCOS have cysts, and the presence of cysts alone does not diagnose PCOS. This condition affects approximately 1 in 10 women worldwide. It is a complex disorder with a wide range of symptoms and varying degrees of severity. The good news is that with proper management, women with PCOS can lead healthy and fulfilling lives. This essay will delve deeper into the intricacies of PCOS, shedding light on its causes, symptoms, and management strategies. To understand PCOS, we must first grasp the normal menstrual cycle. The cycle is controlled by hormones from the brain and ovaries. It starts with the hypothalamus releasing GnRH. GnRH stimulates the pituitary to release FSH and LH. FSH promotes follicle growth in the ovaries. Each follicle contains an immature egg. LH triggers ovulation, releasing the mature egg. The corpus luteum produces progesterone, preparing the uterine lining. If no fertilization, progesterone drops, leading to menstruation. PCOS throws this intricate hormonal dance off balance. One of the hallmarks of PCOS is irregular periods, which can manifest as infrequent periods, prolonged periods, or skipped periods altogether. This irregularity stems from the hormonal imbalances inherent in the condition. In PCOS, the brain often releases GnRH at a higher frequency than normal. This increased GnRH pulse frequency leads to an imbalance in LH and FSH production, with LH levels typically being higher than FSH levels. The higher LH levels can interfere with the normal development and selection of a dominant follicle, leading to the formation of multiple small cysts in the ovaries. These cysts are actually immature follicles that failed to mature and ovulate due to the hormonal disruptions. The lack of regular ovulation also means that the corpus luteum is not consistently formed, resulting in insufficient progesterone production. Low progesterone levels contribute to irregular periods and can increase the risk of endometrial hyperplasia, a condition where the uterine lining grows excessively. Androgen excess, the culprit behind PCOS symptoms. In addition to menstrual irregularities, PCOS is characterized by an excess of androgens, often referred to as male hormones, although women also produce them naturally in lower amounts. The elevated LH levels in PCOS stimulate the theca cells in the ovaries to produce more androgens, particularly testosterone. This surplus of androgens is responsible for many of the outward symptoms associated with PCOS. One of the most common signs of androgen excess is hirsutism, or excessive hair growth in areas where women typically do not have much hair, such as the face, chest, back, and abdomen. Androgens can also contribute to acne, as they stimulate the sebaceous glands in the skin to produce more oil, leading to clogged pores and breakouts. Furthermore, some women with PCOS experience male pattern hair loss or thinning on the scalp. This type of hair loss is known as androgenic alopecia and is caused by the shrinking of hair follicles due to the influence of androgens. Insulin resistance, a common companion to PCOS. Adding another layer of complexity to the picture, insulin resistance is frequently intertwined with PCOS. Insulin is a hormone produced by the pancreas that regulates blood sugar levels by helping cells absorb glucose from the bloodstream. Insulin resistance occurs when cells become less responsive to insulin, leading to higher blood sugar levels. While the exact link between PCOS and insulin resistance remains not fully understood, studies suggest that insulin resistance may play a role in the development of both conditions. In women with PCOS, insulin resistance can worsen the hormonal imbalances already present. High insulin levels can stimulate the theca cells in the ovaries to produce even more androgens, creating a vicious cycle. Moreover, insulin resistance increases the risk of developing type 2 diabetes, a chronic condition characterized by high blood sugar levels. Women with PCOS are at a significantly higher risk of developing type 2 diabetes compared to women without PCOS. Managing PCOS, treatment options, and lifestyle changes. PCOS can be managed with a multifaceted approach addressing hormonal imbalances and symptoms. Treatment plans are individualized based on symptoms and goals. Medications regulate menstrual cycles, reduce androgens, and improve insulin sensitivity. Oral contraceptives and metformin are commonly prescribed. Spironolactone helps with hirsutism. Other hair removal methods include laser and electrolysis. Seeking professional help. Your path to PCOS management. Lifestyle changes are crucial in managing PCOS. Healthy choices regulate hormones and improve insulin sensitivity. Weight loss, even modest, is effective. Losing 5 to 10% of body weight helps. A balanced diet is essential. Limit processed foods and sugary drinks. Regular physical activity is key. Aim for 150 minutes of moderate exercise weekly. Managing stress is important. Yoga and meditation can help. Remember, you are not alone. Seek support from healthcare professionals. With the right support, women with PCOS can thrive. Subscribe for more intriguing videos.